There are two major indications for eye patches. First, they can be used in patients with Bell's palsy to prevent keratitis. Second, they can be used in patients with corneal abrasions to provide pain relief, as long as the corneal abrasion is not caused by contact lenses. Eye patches are believed to promote healing and reduce pain by preventing eyelid motion across a recovering cornea. Patches can also provide relief from discomfort in patients with photophobia by blocking light. Contraindications to eye patching are abrasions caused by contact lenses, corneal ulcers, and suspected globe rupture. There is a risk of infection if a corneal abrasion from a contact lens is patched. Patching of a corneal ulcer may place pressure on the ulcer and deepen the ulcer or perforate the cornea. The pressure from the patch will extrude vitreous contents from a ruptured globe. You will need the following equipment: antibiotic ointment or drops. These can be ciprofloxacin or erythromycin, 2 cotton oval eye pads, and multiple pieces of tape pre-torn to approximately 13 centimeter lengths. Conduct a complete eye exam to ensure the integrity of the globe and the absence of an infection or foreign body. Document the visual acuity for both eyes. Patients should receive tetanus prophylaxis if their immunizations are not up to date. Apply antibiotic ointment to the affected eye. Have the patient sit with both eyes closed and tell the patient to keep both closed until the patch is applied and secure. Take 1 cotton oval iPad, fold it in half, and hold the iPad gently but firmly over the closed lid of the eye to be patched. Then take another eye patch, do not fold it in half, and place it over the first patch. Very deep-set eyes may require a third patch. Keep holding firmly but gently. Then tape the patch in place. Apply the pre-torn strips of tape diagonally from the center of the forehead to the cheek above the mandible. To ensure the correct amount of pressure, lift the lower cheek up slightly before securing the first 2 strips of tape. Don't tape the nasolabial folds, lips, mustache, or the skin near the mandible. Otherwise, eating and speaking will be uncomfortable for the patient, and the patch will rapidly loosen. If the patient has a significant amount of facial hair, the tape may not stick. An elastic strapped pressure patch may be applied instead. Open your eyes. Does that eye stay closed?
Yes.
If the patch is properly placed and taped, the lid under the patch will remain closed. If the patient says his or her lid can open, remove the patch and try again. Tell the patient to see an ophthalmologist or primary care physician in 24 hours to check for healing progress or other complications. A corneal abrasion should resolve in 2 to 3 days. However, patching may be needed longer for Bell's palsy. If the patch becomes loose or your eye starts to move under the patch, I'm going to need you to take it off. Also, I'd like you to be rechecked in 24 hours, either here in the emergency department, at a primary care office, or with an ophthalmologist. So if you can't get an appointment with an ophthalmologist or your primary care doctor, just come on back to the emergency department. Also, since you don't have any depth perception now that you only have one eye, be careful driving or operating machinery. Also, negotiating stairs will be difficult as well, so make sure you don't trip and fall.